Hello and welcome everyone to our event today. It's titled IPC Practices and Addressing Respiratory, Hygiene, and Cough Etiquette. I will be your host for the event today. My name is Alyssa. I'm a Public Health Program Manager at NCUI. I'm also a registered nurse and I'm a Fort Peck Citizen appointed. But today's event is our third and final in this series where we do deep dives looking at micro-learn training resources that were published from the CDC. And in this series, we're going to focus on the CDC's Cough and Congestion Micro-Learn. And as a reminder, this event will also be offering continuing nursing education units. Just a couple housekeeping items. So this session will be recorded for educational and quality improvement purposes. We do ask that you can turn your video on if you can, mute yourself when you're not speaking, and then introduce yourself in the chat by providing your name, organization, and any tribal affiliation. And so just a quick welcome and look at the agenda. Today we'll do an overview and an introduction. We will have a lecture from our CDC SME. We'll do an open floor and then we'll close. And then the survey QR code that we have here and the link in the chat will be shared at the end, but we always appreciate any feedback. And then this is also how you will receive. So before we get started, we do want to do a land acknowledgement. NCUI acknowledges that our national office in DC and nearby activities are situated on the traditional homelands of many Native nations. Some of these communities in the surrounding area include the Piscataway, Pamunkey, Nantego, Mattaponi, Chickahominy, Monacan, and the Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native peoples. And so just a quick background on NCUI. NCUI is a national representative advocating for the 41 urban Indian organizations, or UIOs, contracting with the Indian Health Service under the Indian Healthcare Improvement Act. And so as I mentioned at the beginning, this event is offering continuing nursing units, and we are able to do this through a joint partnership with Cardia Services. Here's some of the information on receiving your CEUs. Upon successful completion of this activity, 1 contact hour will be awarded. If you do have any questions, you can always contact the person here on the screen or myself. And then there are no relevant financial relationships with ineligible companies for those involved with the ability to control the content of this activity. We do want to also acknowledge that NCUI is a proud partner with Project Firstline as supported through our cooperative agreement. The CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. And so before we transition into the lecture component, I do want to acknowledge that we're covering the respiratory season, and I know as a nurse that this can be a very busy time for some of us. And so I do want to remind you all to take care of yourselves as we enter into this season that can be definitely very taxing on your personal life. So I will go ahead and introduce our lecturer today, Zeshan Chisty. You can also call him Z. And we can go to the next slide and I'll do a quick bio for y'all. So Z, he is an epidemiologist with CDC's Division of Healthcare Quality Promotion. Previously, he was a CSTE Applied Epidemiology Fellow and then the Healthcare Associated Infections Coordinator at the Hawaii Department of Health, which I did not know, so it's very interesting. In Hawaii, he was responsible for improving surveillance and outbreak response and growing the HAI program to include public reporting, antibiotic stewardship, infection prevention and control assessment. Z earned his Master of Public Health from the University of North Texas Health Science Center and is currently pursuing his doctorate in public health at the Georgia State University. In his current role, he is working to improve HAI surveillance and IPC amongst Indian Health Services and tribal healthcare facilities. He co-leads DHQP's efforts to improve IPC in the Pacific, supports Project Firstline activities, and responds to public health emergencies. I will now hand over the mic to Z and we can hear from him.
Thanks, Alyssa. And so, as Alyssa mentioned, I'll be covering the cough and congestion micro-learn. Next slide. So just briefly, so this is the agenda for today's talk. I'm going to be just going over the learning objectives really briefly, describing what a microlearn is, and then reviewing key infection control and prevention guidelines that you can practice at your facility, and then kind of cover some key takeaways, and then we can do a quick Q&A at the end. Oh, I think we went one slide too forward, or don't know. Well, the learning objectives are to explain the benefits of using Project Firstline infection control microlearn training resources, two, to discuss and outline the cough and congestion microlearn, including incorporating it at UIOs, and then lastly, to summarize additional relevant CDC core IPC practices. All right. So what is a microlearn? So it's I'll get into that in a second. And what I do want to emphasize is, how can you use it at your facility to prevent respiratory illness? So next slide, please. So a microlearn, it's designed from formative research conducted by PFL's partner, RTI. They developed these series of microlearns. They're guided infection control discussion tools. They provide brief, on-the-job educational opportunities. Each microlearn focuses on a single infection control topic, and currently there are 5 topics. All are available in English and Spanish. These microlearns connect infection control concepts to immediate practical value to the healthcare worker. Healthcare workers can use risk recognition and easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading within their healthcare facility. Next slide. So on this slide, you'll find images from all 5 microlearns. So there's a blood one, there's one for cough and congestion, which we're going to talk about today. There's one for rash, diarrhea, and draining wounds. Next slide. And so there's 3 components to a microlearn, like I mentioned. So there's the first page, which is a user guide, just basically explaining how to use a microlearn. The second is a discussion guide, and then the last is a job aid infographic that you can share with your staff or put up in your facility. And again, these are available in English and Spanish. Next slide. So before really delving into the cough and congestion microlearn, I wanted to briefly review how to use a microlearn. So before presenting it to your staff, you want to make sure that you refer to your facility's policies and protocols and adapt them to the content accordingly. Incorporate microlearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or team meetings. The session should be led or facilitated by an experienced team member with infection control expertise. The microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment, not necessarily in visitors or other staff members. If a team member witnesses a patient in distress, such as shortness of breath or bleeding, they should respond to the emergency per facility protocols. Next slide. So the first step is to introduce the topic. And so in the discussion guide, they provide some sample language that you can use within your facility. And this can vary widely within your facility. You can use the examples provided, or you can adapt your own examples based on your facility's policies, your facility risk assessment, the local epidemiology in your area, or potentially based on the clinical roles or your specific setting, like for example, for the UIOs. But in the examples provided, briefly, a cough in combination with congestion usually signals that there's a virus. 2, these viruses spread easily when an infected person breathes or coughs. And then finally, some viruses don't cause major problems for healthy people, but can be an issue for immune-compromised individuals. Next slide. And so step 2, you're going to now start expanding upon those basics. And here, again, the microlearn contains some examples that you can just use with your facility, some plug and play. But remember, you can pick and choose the topics you'd like to expand on. For example, focusing on vaccinations or source control or ventilation. I'll go in depth into some of those IPC practices a little later on in the presentation. But the examples included within the microlearn are one, if you're near a symptomatic patient and are unsure of the cause, we recommend following recommendations for SARS-CoV-2 and don a face mask or NIOSH approved respirator. And the patient should be placed in a separate room away from others as soon as possible. Next slide. And the patient should wear a mask to help keep their germs at the source. And finally, ensure that the air vents are not blocked to ensure proper ventilation. You know, again, if this is a topic that you choose to expand upon, it's also a good opportunity to reinforce to your staff that knowing who in your facilities engineering department to contact regarding the HVAC system and to reach out if it's not functioning properly. Next slide. And so step 3 is, once you've kind of reviewed the basic guidance or recommendations that you want to discuss with your team, lead a discussion with them to make sure that they understand the information, that they have opportunity to ask any questions, voice any concerns. And so again, using the example that's provided in the microlearn, there's a list of questions here that you can use to help facilitate that discussion. So briefly, what do you usually do when you see a patient who's coughing and has congestion? Do you worry that you might catch something? When might you call for help or assistance? Do you worry that you might catch something? Do you have all the tools and information you need to do your job safely? And then lastly, as your team, how can we help each other to take the right infection control activities when we see a patient who's coughing and has congestion to keep germs from spreading? Next slide. And then lastly, you want to wrap up and reinforce the topic with key messages for your facility or staff. In the example provided in the microlearn, first, you want to reinforce the key takeaways, which is wearing a mask around symptomatic patients for your protection. And then secondly, again, you want to share any facility-specific information that connects the content that you discussed in your huddle from the microlearn with your staff. So in this example that's provided in the microlearn, you want to share that what the respiratory virus symptoms are, what your facility's triage process is, and screening process. Next slide. And so now I'm going to kind of delve in a little bit deeper and talk about what can your UIO do to prevent respiratory infections. So these kind of recommendations can be used for all respiratory infections, including influenza and SARS-CoV-2. Next slide. Okay, so there's 6 parts to this, and I'll go through them briefly. If you were to click on the link on the bottom right when you get the slides, it'll take you to the page where all this guidance is posted, and you can go through it a little bit more in depth if you choose. But so step 1 is to optimize the use of administrative and engineering controls and indoor air quality. So you want to take measures to limit crowding in communal spaces, such as scheduling appointments to limit the number of patients in waiting rooms or treatment areas. Encourage people with symptoms of respiratory infection to sit away from others. So if possible, facilities may wish to place people in separate rooms while they're waiting for care. So, like a sick area or something, you might have seen that in some clinics. Secondly, you want to also explore options in consultation with facility engineers to implement strategies to improve indoor air quality. So guidance on ensuring that ventilation systems are operating properly and other options for improving indoor air quality are available in the following resources. So they're listed on the slide if you do want to check those out. Next slide, please. So number 2 is to communicate about recommended infection control practices. So you'd like to provide instructions when scheduling appointments and post visual alerts at the entrances to your healthcare facility, reminding patients and persons who are accompanying them to tell healthcare personnel about any symptoms of respiratory infections when they first register for care. Wear a mask while in the facility if they have any symptoms of respiratory infections or have recently been in close contact with someone with SARS-CoV-2 infection. and then also to clean their hands after having contact with their own respiratory secretions. And then finally, make sure that you have instructions and alerts that are provided in appropriate languages and with consideration for individuals with learning disabilities or visual impairment. Next slide, please. All right, so this is number 3, practice respiratory hygiene and cough etiquette. So healthcare facilities should ensure the availability of materials for adhering to respiratory hygiene cough etiquette at facility entrances, triage areas, and waiting areas for patients and visitors. It's recommended that facilities provide face masks to people with symptoms of respiratory infections or who've had recent contact with somebody with SARS-CoV-2 infection. To facilitate hand hygiene, provide conveniently located dispensers of alcohol-based hand sanitizers where sinks are available. Ensure that supplies for hand washing, so soap, paper towels are consistently available. Provide tissues and no-touch receptacles for those used tissues. And then finally, ensure that these supplies are readily available and in stock, and then staff know how to request additional supplies if needed. Next slide, please. All right, so number 4 is consider broader use of source control. So first, source control refers to the use of respirators or well-fitting face masks to cover a person's mouth and nose to prevent spread of respiratory secretions when they are breathing, talking, sneezing, or coughing. Masks and respirators also offer varying levels of protection to the wearer. On our website, we have a whole host of information about the types of masks and respirators, including those that meet higher standards that you can definitely check out if you have questions about which face mask or respirator to use. The overall benefit of broader masking is likely to be greatest for patients at higher risk for severe outcomes, like severe illness or death from these respiratory virus infections, and also during periods of high respiratory virus transmission within your community. Source control is recommended for those residing or working on a unit or area of the facility experiencing an outbreak of respiratory infection. So, if you're experiencing an outbreak in your facility, definitely recommend using source control. Next, so during periods of high community respiratory virus transmission, facilities should consider having everyone mask upon entry to the facility to ensure better adherence to respiratory hygiene and cough etiquette for those who might be infectious. You can do this facility-wide, or if you have a high-risk area or high-risk patient population, you can also do that separately in those specific areas. And then, lastly, even when a facility does not require masking for source control, it should allow individuals to use a mask or respirator based on personal preference informed by their perceived level of risk infection. Next slide, please. So this is using appropriate transmission-based precautions based on suspected diagnosis. So you like to advise your healthcare personnel to empirically apply appropriate transmission-based precautions, including placement in a single person room if available, when examining a patient with known or suspected respiratory infection. Precautions should be based on the clinical syndrome and the likely etiologic agent, and modified once the pathogen is identified or a transmissible infectious etiology is ruled out. Just one thing I'd like to note. So if you don't know the etiology or the cause of the respiratory symptoms, generally we recommend using the infection control guidance for SARS-CoV-2, and that link is provided in the references at the end. Additionally, we recommend the selection of diagnostic tests will depend on the suspected cause of the infection in the community or the facility, recent contact with somebody with a known respiratory infection, and then if those results will inform clinical management or infection control decisions. Next slide, please. Lastly, you want to monitor and manage ill healthcare personnel. So just briefly, provide occupational infection prevention and control services for healthcare personnel according to CDC recommendations. Provide and encourage receipt of recommended vaccines. So for example, flu vaccine, COVID-19 vaccines to help prevent respiratory infection and complications like severe illness or death. Additionally, develop sick leave policy for healthcare personnel that are non-punitive, flexible, and consistent with public health guidance to discourage presenteeism, so basically showing up to work while sick, and allow healthcare personnel with respiratory infection to stay home for the recommended duration of work restrictions. So the other thing is to also make sure that your healthcare personnel know who to contact in their facility and what the facility plan is for them to return to work safely. Next slide. So I'm just going to really briefly talk about what can each individual healthcare personnel do to prevent respiratory illness, and just some key takeaways. Next slide, please. So you want to, use masks and respirators to help decrease the spread of respiratory viruses. Make sure you're getting yourself vaccinated and encourage your patients to do the same. Practice physical distancing and implement screening and triage procedures as necessary. Practice respiratory hygiene and cough etiquette. Keep your hands clean, clean and disinfect. Make sure, you read the labels correctly when using those disinfectants. And then lastly, like we talked about earlier, check that air handling in your facility is functioning as it should. And like I said, like if it's not working, know who to go and ask. Next slide. So really quickly, I want to share a couple of slides that Dr. Cohen, the CDC director, presented at a recent American Medical Association webinar. So on this first slide, she presented the recommendations for who should get the COVID-19, influenza, and RSV vaccinations. And you can see, for adults 18 to 59, COVID-19 and influenza are recommended, and then for RSV, it's for a specific population, pregnant folks, and I think it's within a specific time. And then those that are 60 plus, COVID-19, influenza, specifically the higher dosage, and then for RSV, those above 75 years older. Apologies. Next slide. So on this slide, she presented the timings for administration for the COVID-19, influenza, and RSV vaccines. And so as you can see, we're kind of well into September and now are in the window to get all three if those are recommended for you. So again, as part of your Micro-Learn huddle, if you choose to talk about vaccinations, you can definitely use these slides or these, this information as part of your main discussion points. Next slide, please. So really briefly, I want to share a few other resources that can be used at your facility to prevent respiratory infections. Next slide. So this is a flyer on how a facility can look at improving ventilation in their facility. Next slide. So this is another flyer that presents infection control actions that again stop the spread of respiratory infections. Next slide. Again, this is a similar slide to the previous one, but it kind of distills all 6 elements that I had spoken about earlier. Next slide, please. So this is actually one of my favorite flyers that our teams come up with. So this is how to read a disinfectant label. It's got really helpful pointers on how to decipher all the fine print that's on the back of those disinfectants that I think a lot of folks have found very helpful. Next slide, please. And lastly, here are the resources that I use to put this presentation together, or guidance that I referenced throughout the presentation. So hopefully you'll find these helpful. And with that, I will turn it over to Alyssa to see if there are any questions or anything that she'd like to cover.
Great, thank you so much, Steve. This was very informative and practical. So I really appreciate your presentation. There was a question in the chat that had mentioned, so at our all staff, we talked about this very topic, vaccinations, IPC, etc. Can and will the flyers be shared so I can post within my facility? So yes, they will be shared after this. We will send out an email that has this presentation, which it looks like ZU linked things so that they'll be able to. Okay,
yeah, so once you get the slides, hopefully you should be able to just click and it'll bring you to that necessary resource.
Perfect. And then we'll also share any links in the chat as well as we go through the presentation. Did anyone else have any questions for Z? And if you can't think of anything, we'll have another opportunity during our open floor. You're welcome to put them in the chat like you did. You can come off mute. Looks like we do have another question. So any further guidance for the actual threshold at which a facility would implement more stringent masking protocol? Example, 20% positive community rate, etc.
Yeah, no, that's a really good question. And I don't know if we have a specific number that's is that trigger point. If I recall, let me see if I can pull this up real quickly. Yeah, there's not really a number that we suggest that triggers that. There's a few different data sets that folks can reference that they can use to make their own trigger. Whether it be looking at ED department or outpatient visits related to respiratory infections, looking at the ILI or influenza-like illness activity reported to CDC, or within your local or state health department. So there's a few different indicators that folks can use, but I don't think we have a specific number like 20%.
And then I'm not sure if you saw the follow-up comment, but it says South Dakota Department of Health reports number of cases, but unsure to tell rate without knowing how many tests total.
Yeah.
Great. Well, thank you. That's a great question. I wonder that same thing, and I feel like, I don't know if anybody else here is also wondering, sometimes I feel stumped when it comes to what to do if somebody is sick or testing positive for COVID. I feel like there's just been a big shift, where now we don't really focus so much on one pathogen. I don't know if you had anything you could comment on that, Z, that could help guide people when they're thinking their facility protocols.
So, okay, so what so any specifics to developing their facility protocols? Is that the question, Alyssa?
Yeah, sorry, I didn't really ask much of a question. More so the guidance, or if you do have staff who are getting sick, at what point can they come back to work?
Yes. So depending on the illness, so like if it's SARS-CoV-2, we do have some language on our website with some return to work language in there. The one big caveat that I will say though is that certain states may have their own, or local health departments may have their own recommendations or requirements. So please, like I said at the top, making sure that you know your facilities policies, but also being aware of if there are any policies or requirements at the local or state level that you may want to refer or adhere to. And I put that link for the SARS-CoV-2 website there.
Perfect. Thank you so much, Steve. Does anyone else have any questions before we move on? And like I said, there'll be another opportunity to ask if you don't have any. Okay, well, I think we can continue moving on, and feel free to keep putting questions in the chat as we go through. And so for this part of the presentation, I just wanted to cover a few reminders and also a few additional resources. And so as you mentioned, these micro-learns are available in Spanish as well. This was something done through a partnership with another Project Firstline partner, so thank you to them. If you want, you can always print this version as well and hang that around. And this is another, still new to us, but something that we released this year is a transportation IPC checklist. I know that a lot of facilities provide transportation to and from appointments or for other various reasons. And one of the things that we heard is there's not really a lot of IPC guidance around this setting. And so this is a two-sided checklist that you could print, you can laminate it, you can hang it in your vans, you can put it around your facility. And what it does is it provides guidance for your staff on what to do before the trip, during the trip, and after the trip. So these guidances were developed in partnership with CDC, which is great. We're getting good SME eyes on it. But they also sort of follow that base of standard precautions. And then, of course, you want to always follow. But this is something that Zoe will share in the chat for you all. You're welcome to distribute it. Like I said, print it, use it however you feel is relevant within your facility. And so another resource that we were able to develop this year, we know that there's lots of different learners. Some people learn better with graphics. We also wanted to create a video for staff. And so we'll play this video in just a moment. One of the things you can do with this is you could share it among your email chain within your staff. You could put it in your waiting room if you have a TV. But I'll go ahead and let River play this for you all. Just a brief video.
Urban Indian organizations are places of healing and community, but germs can spread quickly if we aren't careful, which is why infection prevention and control is everyone's responsibility. Infection control can easily be integrated into your everyday routines. Germs can end up on any surface and spread to others, so it's important to keep all surfaces clean. For example, medical devices can carry germs that are often in contact with multiple surfaces and people. These devices should be appropriately cleaned and disinfected in between each patient. UIOs serve so many important roles. Be a good relative and support a work culture where practicing safe and quality healthcare are organizational norms. Revisit your clinic's infection prevention and control policies today. Visit ncuih.org.
Great. Thank you for playing that for us, River. So yeah, this is available on YouTube. And it's something that you're able to use in your trainings, however you might see fit. All right, so now we will go ahead and open up the floor to see if there's any new questions that came to mind. I'll go ahead and pause for a moment. Like I said, you can put them in the chat, you can come off mute. You can send it to us privately if you don't feel like asking a question publicly. It looks like Alicia is having trouble accessing the transportation checklist via the link provided. We'll see if Zoe can share another link. Sometimes they can get a little bit finicky. Thank you for letting us know. These are beautiful graphics. Yes, thank you so much. The checklist was created with support from a native designer who works here, and then the videos we do in partnership with Next Animation. We have one other video as well that looks at hand hygiene. Well, while people are kind of thinking of questions, I did have one that I wanted to ask. And so it's that back to school season. I know that we're hosting a lot of outdoor events, and we're doing health fairs. And so Z, one of the questions that we had is, we are having an outdoor health fair event soon. Do we still need to ask people who may be visibly experiencing respiratory symptoms to follow these guidelines, even though we are outside?
No, that's a great question. When you're outside, there's definitely a lot more ventilation that's than indoors. But with respiratory secretions, they can still transfer to somebody. So having that source control, if they're coughing or sneezing, is still a good idea. It's a good recommendation.
That's great. So yeah, Rochelle had asked in here, great question, because we're doing the same thing, a yoga class in the park, suggestions on how to educate or clean equipment.
So that question's a little bit outside of the healthcare space, and we do have another division at CDC who kind of deal with community cleaning and infection control, if you would. So I can try and see if I can pull up their recommendations really quickly and share that with you, Rochelle. or I can, if it's okay, Alyssa, I can send them to you after the fact. Maybe that might be a little bit better. But I wouldn't want to speak to another group's recommendations.
Sounds good. I know some of it's a lot of times the UIOs. I understand with this scenario can be a little tricky, but sometimes it's almost taking the clinic somewhere. No, we're out of powwow. We're going to be doing vaccines. How would you say for that sort of thing, where say they're out doing blood sugar checks or they're doing vaccines, they'll still have, you know, like the table, the glucometers and things like that. If there's any guidance around that.
Yeah, I mean, with any type of healthcare that's being delivered, and wherever that healthcare is being delivered, standard precautions should be your bedrock, that your foundation that you implement, and then based on your risk assessment or the specific activity that you're doing, building from there.
So we do have another question for you. One of the things that we've been hearing sort of in this space is challenges in having somebody who's really designated as the IPC expert. And so our question is, my team is currently experiencing understaffing and the role of our IPC expert is not filled. Do you have recommendations for how to use the micro-learns if we have someone who still has a clinical or public health background, but is not as experienced with IPC yet? But the training, still needs to happen. So we're wondering about that.
No, that's a great question. And so, the micro-learn is designed that, somebody who has some of that basic IPC or public health background can use the information contained, or the example that's contained on the micro-learn as a way to facilitate that discussion. I understand, in UIOs and within Indian country itself, like folks wear a lot of hats, right? And it's always a challenge to keep up with the latest and greatest of infection control. And there's a lot to infection control that folks need to be aware of. So I'll plug in our Project Firstline materials. They generally are easily digestible information that can be used with your frontline staff, your frontline staff, and so that's definitely a place to check out for some quick, easily digestible flyers, training, other educational resources. If you're looking for something a little bit more in depth within the CDC, within our division, we have a number of other training opportunities and webinars that are recorded through CDC Train for the most part. And I can share that link with you as well.
Yeah, that would be great. Wanted to see, does anybody else have any other questions for Z? Otherwise, I might have one more question for you. Perfect, thank you for sharing that. And so one of the things that we've been seeing since COVID is no longer a pandemic, but it seems like fewer people want to wear masks. But there's still, folks who feel more comfortable wearing a mask. And we're wondering if you have any tips on how to ask staff and patients to wear masks without making them feel singled out.
Yeah, that is definitely a tough question. One thing I'll point to that, I know that certain states and local health departments may be requiring this. And so then pointing to that requirement could potentially help in that discussion. If as a facility, based on your risk assessment and, the local epidemiology, if this is something that, you choose to implement as a recommended practice, then you could point to your protocols or your policies for that. But I think this micro-learn process, there's that I think it was step 3 where you kind of facilitate that discussion where you can address any comments or concerns that a healthcare provider might have, if they have questions about wearing a mask.
Great. All right, last question. Is there any other micro-learns that are in the works from the CDC that they're planning to release?
I know there are some in the works. I'm not privy to exactly which topic and where they are in the process, but I dropped our Project Firstline link in the chat, so you can keep an eye on there. I believe there's also a newsletter that folks can subscribe to, but I can double check with our Project Firstline folks on that.
Okay, perfect. All right, I'll wait just one more second, see if there's any more questions. I think I've asked all the ones that come to my mind. All right, we can go to the next slide. So as we kind of close out here, I did want to share a few more reminders. So one of the things that we do here at NCUI is we offer one-on-one technical assistance. And so what that looks like is the Technical Assistance and Research Center provides individualized technical assistance, training, and support to member UIOs. Some of the individual support can include community and staff training, consultation on research and evaluation, consultation on program planning and implementation, documenting local best practices, grant application review, local partnership development, locating archival data to support community work, policies, procedures, and operations. And just an example of what that could look like in the infection control area is that could be something like you need help reviewing your IPC policies and procedures. So Zoe will go ahead and share in the chat the link to our technical assistant submission request. So if anything comes to mind, don't hesitate to submit to that. We can go to the next slide. Right, so we do have a couple other upcoming events. If you're interested in attending more NCUI events, you can also visit this link here. There's a couple of events that we have coming up on the slide. And then I do see a couple of links in the chat. What about a respiratory plan? Were you asking sort of for like the technical assistance, if that's something that we could assist with? Yeah, so I always recommend submitting a request, and what we do on our end is we'll triage that request, try and identify if we have any SMEs within our organization that might be able to address it. If not, sometimes what we'll do is we'll pair you up with a partner UIO who we know may already have something in place. And if that's something that isn't working, we also do have sort of the benefit of working with our SMEs at the CDC like Z, who are also able to help provide some guidance. So definitely I always recommend to submit, and then from our end, we'll see what we can do with your request. And then I'll share that in my IPC committee. Thank you. Yes, that's great. Another thing too in your IPC committees is, I think, sharing the professional development opportunities for certification. So if that's something that you also are curious about, feel free to submit requests, and we can definitely reach out. All right, we'll go to the next slide. Okay, so that brings us to the end of our presentation. Thank you so much all for attending and for asking questions and engaging. It's good to learn from each other. It's a community of learning. We do really appreciate any feedback that you provide. It helps us improve and know what we're doing well and know what we can do better. And then if you're eligible for CEUs, you will also receive them through the survey.